morning. Welcome to a lovely spring day and to our Open Caucus focusing on vaccine hesitancy in Canada. I'm Senator Kuchar from Nova Scotia, standing in as chair for Senator Cordy. Beside me is co-chair Senator Gagne from Manitoba. Now, the Open Caucus is a forum for discussion on issues of national importance. This meeting is co-sponsored by the Independent Senate Liberals, the Government Representative Office in the Senate, and the ISG Group. The Open Caucus is the result of the collaboration amongst 4 senators, Meji, Moodie, Ravalia, and myself. Senator Ravalia is unable to be with us today, but I will ask Senators Meji and Moodie to speak a few words before our panelists speak. Canada has one of the lowest child vaccination rates in the developed world. Many children are now not vaccinated and thus vulnerable to a host of potentially fatal vaccine-preventable diseases. According to a recent study, 1/3 of Canadians expressed vaccine hesitation, which is reluctance or refusal to vaccinate despite the availability of vaccines. Research suggests that the spread of disinformation on social media may be contributing to this resistance. As highlighted by the resurgence of vaccine-preventable diseases across Canada and the proliferation of online anti-vaccine sentiment, there is reason to explore this phenomenon. The health of all Canadians is at issue here. In light of National Immunization Awareness Week, we ask experts around this table, how does the media inform Canadians' vaccine acceptance? What measures can be taken to ensure that the creation and distribution of vaccine-related information is ethical, transparent, and scientifically based? What legislative or regulatory frameworks could be considered? We hope to learn from all your insights and to use that learning to inform further action. Now, just a couple of logistical items before we go further. Coffee is available outside if you wish. I would like to thank the parliamentary staff for their hard work in developing and supporting this event. Translation is available. Headsets are beside in your chair, channel 1 for English, channel 2 for French. We encourage audience participation after the panelists have spoken to have time for questions. If you have a question, please see Sarah. Where is Sarah? There is Sarah Paulowin, and she will help you frame your question. I'd like to ask my co-chair, Senator Gagne, to say a few words.
Merci. Bon matin tout le monde.
Thank you. Good morning, everyone. Happy to welcome you this morning to our Open Caucus, focusing on vaccine hesitancy in Canada. As was mentioned, I am Raymond Gagné, independent senator from Manitoba. And I would like to thank my colleague, the Senator Kuchar from Nova Scotia, to have accepted to be co-chair of the Open Caucus this morning. I would also like to thank my colleagues, Senator Meji, Moodie, and Ravalia, who can be with us this morning, but who have worked hard to organize this event in collaboration with the independent Liberal senators and the Office of the Government Representative in the Senate. Canada has one of the lowest child vaccination rates in the developed world. Almost 10% of children are not vaccinated and are thus vulnerable to a host of potentially fatal vaccine-preventable diseases. According to a recent study, 1/3 of Canadians expressed vaccine hesitation, which is a reluctance or refusal to vaccinate despite the availability of vaccines. Research suggests that the spread of disinformation on social media may be contributing to this resistance. As highlighted by the resurgence of vaccine-preventable diseases across Canada and the proliferation of online anti-vaccine sentiment, there is a reason to explore this phenomenon. We have young experts here this morning, and we welcome you. In light of the National Immunization Awareness Week, we ask experts the following questions. How does media inform Canadians' vaccine acceptance? What measures can be taken to ensure that the creation and distribution of vaccine-related information is ethical, transparent, and scientifically based? As my colleague mentioned, we have coffee outside. Interpretation is available. You can use the headsets located at your chairs. And channel 1 is for English and channel 2 for French. We will invite the audience to participate in the conversation. If you'd like to make a comment or ask a question, please go see Sarah. Just raise your hand and she'll note your name and we'll give you the floor later. Senator Kuchar.
Senators and physicians, before we turn over to our esteemed panel, Senators Méger and then Senator Moodie.
Bonjour à toutes.
Good morning, everyone. I am Marie-Françoise Méger. I'm Senator for Quebec. For Rougemont, as you know, today we will be talking about vaccines. This has become more and more of an issue given vaccine hesitancy. Before vaccines, there were various diseases like polio, measles, and others killed many Canadian children or made them seriously ill. Since vaccination, we were able to eradicate some of these diseases, and these diseases disappeared from North America. Unfortunately, the new generations who benefited from these vaccines are forgetting the benefits and have generational amnesia. So thank you to the panelists to be here this morning to discuss vaccine hesitancy. And I am sure that your testimonies will help our reflection on the topic and inform us on how to protect Canadians while taking into account their various preoccupations.
Welcome. My name is Rosemary Moodie, Senator from Toronto. And to the panelists and all of you who have given us time today, thank you very much for coming. As a pediatrician, healthcare provider, this topic is dear to my heart. We deal with it almost every day in our lives as healthcare providers, and we are all concerned, I know, about the rising rate of vaccine refusal and hesitancy. We're also concerned about the misinformation that is prevailing and very much a part of this story. This public health crisis affects us all. The rise in vaccine-preventable diseases is evident for all of us, and it's present very much in the media, almost on a weekly basis. Certainly, we hear about new outbreaks in Canada, Vancouver, in Europe, and in the news this morning, New York City. So we are here today to try to air this topic, to have some good dialogue, to come away with some clear ideas as how we as a Senate can engage moving forward to bring some perhaps solutions to this issue, this new public health issue that's of rising concern for all of us. So welcome, and let's engage in a really good conversation.
Thank you very much. We'll start with our panelists. Each of the panelists will speak. When the panelists have finished, we will have the questions. So it's a privilege to kick off with Dr. Noni MacDonald, who is an old friend, meaning we've been friends for a long time. Dr. MacDonald is a pediatric infectious disease specialist and a world expert on vaccines. She is a professor of pediatrics at Dalhousie University and the IWK Health Center in Halifax. She is former Dean of Medicine at Dalhousie University and was the first woman in Canada to become a Dean of Medicine. She has been internationally recognized as an advocate for children and youth health and as a leader in pediatric infectious disease and in global health. Dr. McDonald.
Thank you, Dr. Kuchar. I'm pleased to speak first in that I'm going to set the stage for vaccine acceptance and uptake and do an overview for you in like 5 minutes. The first thing I want to say to set the stage is I work a fair amount with working groups, and I'm on significant committees at the World Health Organization. And the World Health Organization has listed vaccine hesitancy in the top 10 global health problems. All right? And you need to understand why. So for measles, for example, 21 million children would have died in the last 10 years without immunization. So this is not small potatoes, people. This is big. So as has been noted before, Canada's uptake rates, when you look at the other OECD countries, and I also stuck Cuba in there, just because it's a close neighbor, we are not doing so well compared to everybody else. We're doing okay in that we're in the high 80s. But for example, for measles, you need to be over 95%, and we're not anywhere close to that. And it's no surprise when measles gets imported into Canada that we end up with problems. So I want to just show you this continuum between acceptance of all vaccines on time, on schedule, and down there to the refusers. So the first thing I want to point out to you, it's a continuum. So please understand that over 80% of parents in this country do immunize their children. They get all their vaccines. Of those, though, there are still some that have concerns. They still do it, but they are worried. And part of their worries come from things, as Senator Moodie was saying, that they read online that are not good information. And then when we go down to the very bottom, we've got some who refuse all. We know from the data that's been looked at recently, we're only talking about less than 1%. But boy, are some of those less than 1% noisy. All right. And they get heard a lot. And disproportionately, people think this is therefore really common to refuse all vaccines when it is not that common. The norm in Canada is to accept, but we need to have everybody understand that's the norm so they can become more part of the norm. So vaccine hesitancy was defined in 2014 by a working group for the Strategic Advisory Group of Experts on Immunization that I'm on. And it refers to the delay in acceptance or refusal of vaccines despite the availability of vaccines. You cannot be hesitant if you can't get at those vaccines. That's not hesitancy at all. It's when you are offered and you don't come forward to accept. It's very complex. It's context specific. It varies across time and place, and it varies with the vaccine. It's not the same for everything or everybody. It's influenced by factors such as complacency, convenience, and confidence. So what do we mean by confidence? Confidence is about trust in vaccination, trust in the government, trust in the immunization program, trust in the healthcare provider who's giving you that immunization. It also is about complacency. Excuse me, people forget this one. Because vaccine-preventable diseases are not that common in Canada, many parents and many adults have never seen them and don't understand it and don't recognize them as being serious. And they have other life crises that taking more prominence for them, like getting groceries for the kids, getting their kid to soccer, and so on and so forth, instead of paying a lot of attention to immunization. It's not that they distrust or have no confidence in them. It's just that the other things have more precedence for them, and the other things are more important. The last one, and probably the most important one and the most under-recognized one, is called convenience or constraints. We don't set the healthcare system up to make it really easy for you to get immunization. So we talk about having free immunization in Canada. Listen up, folks, it's not free. If I am a by-the-hour worker in a coffee shop, if I have to take off 3 hours to get my child immunized, I'm not earning that money for those 3 hours. I may have to pay to park, and maybe that's going to make the difference of what I'm going to be able to feed my kids for supper. So it isn't free in that sense. And the health system needs to become much better at delivering this in an easily accessible, time-convenient, without constraints way. If I have to go to a public health clinic and pay a $10 parking fee, listen, that's not convenient. So we need to get over that. We need to be welcoming of people when they come forward, not being disrespectful if they don't speak our language, if we don't know their cultures. We have a lot to learn about making it really easy and convenient for people to get immunized. This next slide is really important. How all of us in this room perceive risk, everybody globally, it's not special, and how we make decisions is related to our perception of risk. If you hear a fact that agrees with your belief, you will hear that fact. If you hear a fact that doesn't agree with your belief, you won't even hear me. And what we have to do as a healthcare system is rewrap those facts for the people who can't hear in a way that they can hear. This heuristic is called assimilation bias. It's common. And when people are online, it is a real problem because the facts that they hear, and I'm putting that in quotation around the word fact, may not be pro-vaccine. It may be very anti-vaccine. And that then fuels their belief that this is what's going on. So we are strongly influenced by what we think others around us are doing or expecting us to do, our social networks and our social norms, okay? We see causation in coincidence. That's because we're hardwired to do that. It's when you touch the stove when you're under 5 years of age, you go, oh my God, that was hot, I can't do that again. That's causation and coincidence. They don't understand coincidence, and many adults aren't good on coincidence either. We see what we believe rather than believing what we see. We prefer anecdote and stories to data and evidence. Everybody does. Even I, as a professor of pediatrics, I like stories better. They're easier to understand and remember. We pay more attention to negative information. How we frame what we say about immunization matters big time. So if I say a vaccine has 0.1% side effects, that is heard loud, much louder than if I say it's 99.9% safe, even though I'm saying the same thing. So often we frame things the wrong way around to be heard well. And many may not trust the health system or the government, and they think natural has to be better. Well, that's not really true for vaccine-preventable diseases when you're dead, or when you're deaf, or when you have brain damage, or when you're paralyzed. That's not better to have had it naturally. This is a very big, busy slide that fortunately is translated into English and French, so you get all the pieces together. I just want to make a couple of points. This is about the complexity of trying to deal with this. One of the pieces is fake news and fake information and misinformation. 5 to 10 minutes on an anti-vaccine website, 5 to 10 minutes changes intention about immunization. This is a hugely powerful negative tool, and Google and Facebook are going nuts with anti-vaccine websites and viewers. So, and social media, as I said, really matters. We have a whole generation and maybe several generations of science illiteracy where they cannot do the logic that you need to do to take fake news and really unpack it and say, why is this just wrong? We have social clustering of anti-vaxxers, both geographically. You live near your neighbors and they may be all the anti-vaxxers. They may go to the same, your kids may go to the same schools, and also on social media. And we very much lack a perception about how important community immunity is. Community immunity means all the rest of us are immunized. We protect those who are not immunized. One of the reasons that we have not had the same outbreaks of measles in Canada that have been seen in Germany, for example, that have been doing really, really well, is we're a little over 90% with measles. And so the measles outbreaks have been in small clusters, but around them, we've got lots of people that are immunized. If we didn't have that, we would look like Venezuela right now, okay? Which is a disaster in a basket case for measles. And Brazil is falling off too, as well. The other belief is that natural infection is good for immunity. Well, actually, that's not really true, okay? For example, if I had tetanus, after I've had tetanus, if I've survived, and 10% of us will not survive, we are dead, not just a little bit dead, but completely dead, okay? If I survive, I still need to be immunized because I'm not protected. I could get tetanus again. And most people don't understand that. If you want to be protected against tetanus, it doesn't matter if everybody else in the room is. You are not protected unless you are fully immunized. ever, okay? It's like a done deal. And the last thing, as I said, we have a lack of memory about vaccine-preventable diseases. So I grew up as a very young child when polio was still around. And one of my best friends, when I was 5 years old, I'm not going to say her name, protecting privacy, who lived down the street from me, got polio in the summer. And when I came back to go to grade 1, she wasn't there. So for me, this is deeply personal. I don't want any child to have most of these diseases, because as an infectious disease specialist, I will tell you, there is nothing sadder than standing at the bedside of a parent in an ICU with a child who's got a vaccine-preventable disease who's dying. And they'll turn to you and say, well, what can you do? And I said, well, we have to look and see where we can go forward and do the best we can, but you can't beat yourself up at this point. What you need is to love your child and be with us as we go forward. But it's tearing our hearts out as a healthcare worker, knowing that this could have been prevented. So what can we do to address hesitancy? Sadly, I wish I had a magic wand or a magic bullet or a fairy dust or something, but there isn't. But we do know that we need to directly target populations and subgroups who are under-immunized. We know that we need to determine what the causes of their lack of acceptance are, and we need to work on those and with partners help them solve these problems. It's not just about increasing knowledge and awareness. A knowledge dump and a knowledge gap isn't what the whole problem is. It's way more complicated than that. And there's lots of evidence over and over in the last 5 years or so to show that multi-pronged approaches are much better than single strategies. No magic bullets. So I just want to do 2 quick strategies because I think they're very important. And the latter one is particularly for the Senate. So the first one is we need to shape those beliefs about vaccines. We need to be teaching our children and youth about the benefits of vaccine, why you need them, the risks of diseases, how safe vaccines are. And we need to weave this into history and science and health. We need to teach scientific literacy because it's not just about immunization we've got a problem. There are so many other issues around health where science literacy is a catastrophe. I mean, a lot of the homeopathic medicines that you can find in your drugstore too, there's no evidence that any of them work. They just take your money. And then we have lots of people with cancer and heart disease, again, who want a magic. And there is no magic. There's just the things that we have evidence for. And pick your disease, chronic disease, and there's a ton of science and literacy around it. One of the pieces we need to engage expert teachers and students, and they need more resources. I don't know how many of you know about Kids Boost Immunity that the BC CDC put together. You can see it online. I gave you the website there. This is a series of questions that you can answer around immunization. And if you get an answer right, they will donate a dose of vaccine to UNICEF, which is pretty cool, I think. When I talked about this website when I was in Finland last summer, and one of the people in the audience said to me, you mean when they do this and they get the question right, the prize is that they get to donate a dose of vaccine to UNICEF? And I said, yes. And then they said, that is so Canadian. All right. And they all laughed and applauded. And I guess it is Canadian. Okay. Because we do care about others. We do want others to be fully immunized. But I hadn't thought about it that way when it was really being put together. The other piece I want to talk about is working collaboratively and in partnership. This is a key asset. Everybody needs to be speaking up about the importance of immunization, both in private and in public, including the senators. And why? Because the more we know, there is evidence for this. This is not just me babbling. It's called the gateway belief. The more scientists and people speak up about something, the more the general public sees it as likely to be true. Okay? So it's called the gateway belief. It has been tested for immunization as well as climate change. So we all need to be speaking up. It also adds time, it saves time, adds resources and voices, and enhances the credibility of those frontline healthcare workers who are immunizing. Last point I want to make is we must not neglect those who are accepting immunization. We need, we need to value their decisions and pat them on the back for doing a good job. We need to reinforce their messages. We need target communication to them, not just at the people that are being hesitant. And we need to absolutely exploit their social networks and social contagion. We know, and there's evidence again, that if I tell somebody something and they tell at least one more person, this becomes contagious. So we need to exploit the positive contagion among people who are accepting vaccines. Whether they be teenagers, whether they be parents, whether they be seniors, it doesn't matter. We need to be able to help them become our immunization champions. And lastly, we need to reinforce that vaccine acceptance is the social norm in Canada. We just want it to be over 90%. Thank you very much. And we need to get there. So thank you.
Merci. Thank you. I was taking notes. I wasn't ready for the end of your presentation. Merci beaucoup.
Thank you very much. Thank you very much for this presentation. And I'd like to introduce to you the next panelist, Dr. Theresa Tam. Dr. Tam was named Canada's Chief Public Health Officer on June 26, 2017. She is a physician with expertise in immunization, infectious disease, emergency preparedness, and global health security. As the federal government's lead health professional, Dr. Tam provides advice to the Minister of Health, supports and provides advice to the President of the Public Health Agency of Canada, and works in collaboration with the President in the leadership and management of the agency. Dr. Tam has served as an international expert on a number of World Health Organization committees and has participated in multiple international missions related to SARS, pandemic influenza, and polio eradication. Dr. Tam, thank you. Good morning. Good morning, everyone.
Members of Parliament and other distinguished guests, many of whom I recognize as public health and colleagues. This is a great opportunity, I think, to discuss a really important public health issue. And à titre d'administratrice en chef de la...
As Canada's Chief Public Health Officer, I am very concerned to see vaccine-preventable diseases, particularly those as serious and highly contagious as measles, making a comeback in Canada and around the globe. A death of a child is completely unacceptable. In an era where, thanks to the success of vaccines, we are no longer familiar with these dangerous illnesses, some parents have come to fear the prevention more than the disease.
And the vaccine uptake is high, relative, really not bad. As Leonie has said, the anti-vaccination rhetoric is current and a growing threat. And so the seeds of doubt are often being planted by misleading, or worse, completely false information being spread by campaigns that are targeting parents on social media and the internet. So it's no wonder that parents are confused and concerned right now. As Noni said, vaccine refusers are actually a relatively small group. Our most recent survey shows that only 2.3% of kids under 2 in Canada have never been vaccinated. This small group, though, is spreading this false information far and wide, and they spend a huge amount of time, energy, and their attention to twist and bend the truth that vaccines are safe and effective. And peddling misinformation is not benign. It's not just a nuisance, because the outcome could be death, whether from measles, whooping cough, or other vaccine-preventable diseases. And it's not just in developing countries that we're seeing vaccine-preventable diseases. Measles is going rampant in Europe. So between 2017 and 2018, there were over 82,000 cases with 72 deaths from measles. So this is a global issue, but Canadians don't live in isolation. So while we've eliminated domestic measles, our
we don't have domestic strains of measles circulating in Canada and hasn't had that since 1998, Canadians travel. So when they go to other countries, they import measles into Canada. And so you've heard on the news, a single traveler with measles can spread measles before they get the rash. So you don't even know you have it. You then go on a plane, go through an airport that's really busy, and then end up at the ER. And so it requires local public health a massive amount of resources to do those kind of contact tracing, to go and communicate with people who might be at risk because measles is so contagious. So as Dr. McDonald's already indicated, there are many reasons for vaccine hesitancy, and she very elegantly sort of put them into buckets for us. So the underlying, because of these underlying reasons, we have to have a multifaceted approach to tackling the issue. And so broad interventions are necessary, including how to address misinformation on those social media platforms, how to educate professionals and the public in more effective ways. However, we also need more targeted solutions, as Noni has said. You need an actual understanding of where pockets of under-immunization are and to tailor the intervention based on your understanding of your local community and why they are hesitant. And so in order to get from 90 to 95, that 5% takes a huge amount of effort. And any time that we're trying to eliminate or eradicate a disease, we have to, that last bit is actually quite a challenge. And to close the gap, we can't just have blanket solutions. It has to be more targeted as well and informed by research. So how do we actually address misinformation on social media? So just correcting the facts is, of course, important, but we need to understand how these health-related false information is spread and what techniques are being employed by the anti-vaccination group. Noni has mentioned some of the techniques, and I'll just go over some of those a little bit. So they're a tiny group, and if you do an internet analysis, you will see that they are very, very good at amplifying their information. They often latch onto conspiracy theories, so messages that essentially try to divide and undermine social trust as fundamental to their techniques. They use fake experts, so you have a doctor, someone in front of their name, but they are actually not physicians. If you dig a little bit deeper, they're not vaccine experts. They cherry pick information. They also appeal to parents' need. People are anxious. They want to, when you're just about to vaccinate a child. And so parents are more inclined to listen to things that, solutions that reduce that anxiety. And some of the kind of fake solutions that people come up with essentially caters to that impossible expectation of no risk. Of course, nothing is without a little bit of risk. But not vaccinating is a risk. The risk is disease and potentially death. So, and of course, information is misrepresented and appeal to false logic. But they do, the technique of repeating is a massive issue. And so I think when we conducted the Public Health Agency in Canada an online diagnostic, if you like, of the anti-vaccine community, we found that they produce very flashy, professional-looking contents and sites. They use narratives. They use visuals and graphics and emotion-triggering stories. And the most prominent accounts share each other's account almost immediately. And they amplify each other. And they are prone to this selection and confirmation bias that Noni has talked about. And there are these bot accounts involved as well, if you look at the intel. And they're created simply just to retweet things. They don't have any underlying, piece behind them. And so they are definitely at work. So how do we take action? so that the 20 to 30% of Canadians who are questioning immunization don't get impacted by this false information. So public health thus need to do a better job at tackling social media. Engaging the major social media platforms are really important. We've heard some of them making a bit of an effort recently, and that's a good start, but not enough. Some of this, involves, Facebook or Google, YouTube, trying to demote and isolate and de-rank that type of information, stopping ads from being posted on those sites. But also there are ideas now to promote and sort of lift up those credible information sites. So that's one strategy, is to float up the credible information and bury the fake news, essentially. But as Noni has said, facts alone and more facts don't change minds. We've tried that for decades. This is what public health is actually good at, is actually giving you the facts. But rewrapping the facts in a way that people can hear, I think, resonates with me for sure. We do have other research that we can tap into, behavioral insights. And so, we need more of that too, to understand vaccine hesitancy and address people that will increase trust, address emotions, and not just the facts. So I think one way is to identify key community influences to enable those parents who do vaccinate their children to tell their stories. For example, Tara Hills is a parent who is very effective in telling her stories, her journey, being impacted by vaccine-preventable disease. So there are influences of parents, youth, and others that we can tap into. Because I'm pretty realistic in that people don't try and follow me and listen to my messages. They're going to follow those social media influencers, and perhaps Tim. And so, so I think we mustn't forget, though, that parents do listen to the healthcare providers. They do trust their pediatricians and their family doctors. And so we must enable those frontline health professionals to be able to have those open, respectful conversations in a more effective way. And so this kind of dialogue, there are now tools to train physicians how to have what we might, one technique is called motivational interviewing, and which is fundamentally founded on respect. But another perspective is that you can't necessarily squeeze in a considerable amount of conversation in a quick clinic visit. Some of the techniques are engaging women when they're pregnant. So when they have time to be reading about how to, embrace new parenthood, that's the time that they have a bit of time to read, and you give them information so that when they come with their babies, they're actually ready to be vaccinated, and never lose an opportunity. People come in for all sorts of reasons. But I think in the media you've heard recently, a parent who said, well, way back then I was impacted by false information. I do want to get my kids vaccinated now, but maybe their physicians hadn't even asked that question when they came in for something else. So I think don't lose those opportunities. And educating parents and Canadians on vaccines and the facts is important, but also digital literacy. So how do you teach that from a very early age? And in fact, kids at school, I think, do get taught some of that now, to say, how do you sort of spot non-credible sites and people trying to scam you? But maybe the generations of us who didn't grow up with social media and were not taught it at school need some other tools to help us as well. And I know that, for example, the Canadian Pediatric Society has compiled a list of questions to help parents identify and rule out websites that are sources of misinformation. And so, as the Chief Public Health Officer, I am engaging the social media platforms. The agency has tried to be smarter and more creative now and putting up videos of parents and their stories. And we've launched also the Immunization Partnership Fund. This fund funds the Kids Boost Immunity Project, for example, of the BC CDC. We have some online tools. CanVax, for example, supports health professionals The Canadian Public Health Association is here in the audience, and they support a lot of these sites, immunize.ca as well. The other thing is that, as Noni said, some of it is just busy parents. So we've also supported a project called Can Immunize, a mobile application that parents can have the app on the phone, be alerted to when they need to vaccinate their kids, and keep that immunization record at hand. And in some cases, like Ottawa Public Health, they can connect with their immunization record system. So just to end that, I think what Noni has said is the Canadian values are clear, and parents do want to protect their kids. While we are in troubling times and with the pervasive spread of information, I've never quite seen an opportunity like this. Senators engage, parents are asking questions, people are, scientists and public health are appearing on media to try and social media platforms are beginning to get engaged. So I think we've got to seize this moment as a collective, collaborate, and really take this opportunity and boost up this sort of behavioral science informed gateway belief methodology. So I think I think really my ending tagline is that when it comes to vaccination, hesitating or taking no action is a decision, and that decision comes with consequences.
Thank you, Dr. Tam. Words of wisdom, for sure, and rest assured that we in the Senate look forward to working with you and your team to move this important agenda forward. Now, it gives me great pleasure to introduce our next panelist, who is Andrew Kuchar, a health reporter and columnist for the Globe and Mail, where he's been a staff writer since 1987, also the author of 5 best-selling books. And in my opinion, Mr. Kuchar is the doyen of all health journalists anywhere. That wasn't in my speaking notes. He's an 8-time nominee for the National Newspaper Awards, Canada's top journalism prize, past winner of the prestigious Michener Award for Meritorious Public Service Journalism. He was named Canada's first public health hero by the Canadian Public Health Association. He is the champion of mental health, provided by the Canadian Alliance on Mental Illness and Mental Health, and has received the Queen Elizabeth II Diamond Jubilee Medal for his dedication to improving healthcare. Mr. Kuchar.
Well, thank you, Senator Dr. Kuchar, and thank you for including me on such an esteemed panel. It's quite an honor. So as you know, in recent years, there's been a troubling resurgence of childhood diseases like measles, mumps, whooping cough. These illnesses are easily preventable with cheap, effective vaccines, but far too many Canadians are not vaccinated or under-vaccinated. So it's important to understand the drivers of vaccine hesitancy and to develop policies to counter the damage that can result and that is resulting. So I want to start by commending the Open Caucus for addressing this issue, using your forum in the way you are. So I want to start with some context. We have to remember that fear of vaccines has been around as long as vaccines themselves, since 1796. It's not going to disappear overnight. The worries today are many and they're varied. The notion that vaccines contain poisons like mercury, skepticism about the need for vaccines, the belief that children's immune systems will be overwhelmed, fear of needles, the fallacy that all that is natural is good, even viruses and bacteria, distrust of big pharma and government, to name only a few. There's a long list. As a result, there must be diversity of responses. We all have to do our part to protect children, policymakers, public health officials, scientists, clinicians, educators, journalists, and parents. It's not any one person's job. And above all, I think we should never forget this, we have to ensure that our actions don't harm children, even unintentionally. That has to be the end goal, to protect them. That's why I'm not a big fan of initiatives like No Jab, No Pay that they have in Australia. I'm not a fan of excluding unvaccinated children from school unless there's an outbreak. These measures may seem important, but they harm the vulnerable disproportionately. We should endeavor to persuade, not prosecute, even though it's a lot harder that way. So how should we respond? As you've heard from people, there's a very small hardcore of anti-vaxxers. This is a tiny minority of intellectual and moral degenerates. people who wear Stars of David at their protests and spread false claims about vaccination causing autism. They deserve to be condemned and marginalized and exposed for what they are, charlatans who are cashing in on fear. That's a tiny minority. But I believe, and I think the research backs me up on this, that the large majority of those who don't fully vaccinate their children are well-intentioned, if misguided. They want the best for their kids. They just have doubts and they have questions. They don't need to be demonized. They don't need to be punished financially or ostracized. Vitriol will only drive them into the anti-vaccination camp, and that's the last thing we want. However frustrating it may be, their fears need to be assuaged. We know, and Dr. MacDonald explained this very well, that beliefs will always trump science, but we still have to try. Health promotion is a thankless task. Dr. Tam knows this better than anyone. The paradox of public health is that the more successful you are making threats disappear, the more difficult your work becomes. Vaccination is a perfect example of this. We've tackled these diseases, they've almost become invisible, and so we take them for granted. Public health and medical practitioners should do what they do best. They should promote harm reduction. So let me give you a couple of concrete examples of what I think can be done and what's being done. Nobody likes needles. They don't like to have their kids getting needles. So let's take the needle pain out of the equation with simple strategies like breastfeeding and numbing creams. A group of researchers and parents has promoted these methods with a viral social media campaign called It Doesn't Have to Hurt. Initiatives like this create trust and spark conversation, and they need to be encouraged. That's parents speaking to parents. And let's not forget that the greatest influencers when it comes to whether parents vaccinate or not are their peers. It's not scientists and not journalists. It's their neighbors and friends and family that will ultimately help them make up their minds. But if journalists, of course, have a part to play. I'm the token journalist here, so I'll address that. I think we covered vaccination pretty badly for a long time with false balance, this notion that there are two sides to every story. There aren't two sides to this story. But I think we've largely abandoned that. We've realized that our job as journalists is to distinguish between evidence and nonsense. And the dominant media narrative today has become the accurate one, that scientific evidence supports the safety and effectiveness of vaccines, and not vaccinating endangers public health. We've also become more conscious of our photo choices, not portraying vaccination with screaming babies and giant needles. But we have a lot of work to do on that front as well. Fear-mongering and false information about vaccines, though, doesn't spread principally through mainstream media, but by social media. We've heard that mentioned several times. Social media like Facebook and so-called alternative publications like Natural News are the ones doing the real damage. I don't really know what to do about them. You heard some good suggestions earlier. I don't know what we can do other than try and counter falsehoods at every opportunity, to fight in their sandbox on social media. We need to call BS at every opportunity, and loudly and clearly. So what about politicians and policymakers? I think they should lead by example. When the health minister posts a picture of herself getting a flu vaccine on Twitter, that's important leadership. We should all do that. I do that every year on my Twitter feed. But we should do much better in the policy field as well. That every province and territory has a different childhood vaccination schedule, to me, is a travesty of public policy. How can we tell parents that following Bob Sear's alternative vaccine schedule is dangerous when we can't get 13 provinces and territories to agree on a common timetable? I would suggest we lock all the health ministers in a room and don't let them come out until there's one vaccine schedule. Now, similarly, we get alarmed about falling vaccination rates, but we don't really have a good grasp on the data. We don't know exactly who is vaccinated for what in much of the country. Some provinces track well, some cities track even better, like Ottawa, but some do so quite poorly. Far too many, actually. There's a saying in economics that if you don't count it, it doesn't count. It's a reminder to me that we've taken vaccination, and by extension, children's health, for granted for far too long. We have to make data collection a priority. Now, because I'm speaking to legislators, I'd also be remiss if I didn't mention the need to compensate those who are harmed by vaccines. It's a very small number, but it needs to be done. In this country, only Quebec has a vaccine damage fund that compensates. If we're going to strongly encourage vaccination, and even make it mandatory in some circumstances, then I think there's an ethical obligation to compensate people in the rare instances that they suffer disability or death as a result. This principle, known as reciprocity, is essential for building public trust. In closing, we shouldn't pretend that tackling vaccine hesitancy is going to be easy, because it's a symptom of something much, much larger. How can we ask people to selflessly vaccinate themselves and their children for the benefit of the collectivity when we glorify individual freedom and selfishness? How can we expect people to believe scientific facts when lies have become the common currency of public discourse? And I won't mention what's his name. How can we expect people to trust public health when they are profoundly distrustful of all public institutions, and sometimes for good reason? The science is settled. We've heard that over and over this morning. What remains unsettled is the best way to reach and convert the doubters and the haters. That's also unsettling, but no reason to stop trying. Ultimately, we want to live in a country and in a world where infectious diseases are invisible. They're no longer a threat to our children. We want to live in a world where people actually have the luxury of skepticism about the benefits of vaccination. Thank you.
Merci, Monsieur Picard.
Thank you, Mr. Picard. I always find your articles very wise, and your presentation was just that this morning, so thank you very much. Our next panelist is Dr. Anna Banerjee. She is a pediatric infectious and tropical disease specialist who trained in Toronto, Ottawa, Montreal, and Harvard University. She is the Faculty of Medicine Lead, Post-MD Education Lead for Indigenous and Refugee Health. She has been studying lower respiratory infections in Inuit children for almost 25 years, where her research has led to changes to the national guidelines for the prevention of RSV. Most of Dr. Banerjee's clinical work for the past 20 years has focused on immigrants, refugee, and internationally adopted children. She uses a human rights framework for her work, research, and education, and is an advocate for vulnerable populations. She has won several awards, and in January 2012, she was inducted into the Order of Ontario. Dr. Banerjee.
Thank you very much for inviting me. I didn't know what to say after speaking, after all these esteemed panelists. So my talk is a little bit different, and I'm going to talk about vaccine hesitancy from a social responsibility perspective. So I'm a pediatrician, tropical disease specialist. I was a former associate medical officer of health in charge of outbreak control. And one of my current jobs is to assess newly arrived government-assisted refugee children in Toronto. I have traveled around the world, and I have seen children die from preventable diseases such as measles. I have seen adults and children suffer from paralysis as a result of not-so-remote polio infection. I see return travelers who come home with vaccine-preventable diseases. I've seen the effects of war, poverty, and the breakdown in public health infrastructure, allowing vaccine-preventable diseases to reemerge. Diseases that were considered historical in most parts of the world have resurged, such as diphtheria in Bangladesh. I have to assess healthcare workers that return from this epidemic. So diphtheria is potentially a new threat to us. The recent measles outbreak is more evidence of what happens when people are not vaccinated. All of this reinforces that vaccines work. When I assess resettled refugees in Toronto, the families line up for their vaccines. They never complain as they have witnessed the ravages from vaccine-preventable diseases, especially in the presence of poverty and malnutrition. I have also seen outcomes where effective vaccines are not given to populations at high risk, even in Canada. Inuit babies in Nunavut have 40 to 60 times the rate of admission compared to the Canadian average due to a virus called respiratory syncytial virus, RSV. In fact, they have the highest rate of admission for RSV in the world. During the RSV season, Inuit babies from Nunavut fill up intensive care units in Ottawa, Montreal, Edmonton, and other hospitals across Canada. In intensive care units, they're separated from their families. They can be on life support for prolonged periods of times, and I'm aware of complications such as stroke, kidney failure, secondary bacterial infections requiring parts of the lungs to be removed. And sometimes these babies die. Many die in communities, never making it to a hospital. The vaccine hesitancy is really not the community, but us, Canadians and public health specialists. Since 2001, there has been an effective antibody called palivizumab, but because it's expensive, it is restricted to infants considered at high risk for severe RSV, primarily premature babies and those with cardiac conditions. The fact is that otherwise healthy Inuit babies are 4 to 10 times the rate of admission compared to these high-risk babies that currently get the antibody, but they are not getting it in Nunavut. Last year in Nunavut, there were nine deaths in children under 5 from January to May during the RSV season. Most of these were babies. While I don't know how many of these deaths were attributed to RSV, it would be like an additional 300 deaths in the same time period in Toronto. If one child ends up in the ICU or dies of a vaccine-preventable disease, and most of the rest of Canada, it would make front page news, except if you're Indigenous. This is unfortunately also very Canadian. What makes this more tragic is that if the vaccine is given, it works up to 96% of the time. Additionally, the cost of the vaccine is much cheaper than the cost of admission due to the high rate of RSV infection, expensive medical air evacuations, and prolonged intensive care stays. It is cheaper to prevent than to treat. This is a case of a vaccine-preventable disease that has a major impact on the lives of Inuit babies and their families and can have long-term consequences. Maybe we need some social responsibility here. There's no questions that vaccines work, and in general, they are cost-effective. And in fact, vaccines with clean water are some of the most successful public health interventions ever made. The evidence is there. While the majority of Canadians support vaccines, a minority are hesitant and some are opposed. I believe that people are entitled to their opinion, but however, misinformed opinions and conspiracy theories have no place in public health policy. Some may argue that mandatory vaccinations restrict people's freedom. However, we live in a society where every day our freedoms are restricted. For example, we have to wear seatbelts. We have to stop at red lights or face the consequence. And we had to be screened to walk into this building. We make these contracts for the betterment of society as part of our social responsibility. With the benefits of living in a publicly funded healthcare and education systems, we have responsibilities. While someone may not believe in vaccines and put their child at risk, the problem of not vaccinating their children is that they put other children at risk. We need to vaccinate children to protect those who cannot be vaccinated. For example, a child with immunodeficiency or cancer. In addition, we need to vaccinate all eligible kids to create herd immunity and to prevent outbreaks. Social responsibility means that we vaccinate our kids to protect all kids. When all the evidence shows that vaccinations prevent outbreaks, save lives, and save money, I think it's the right thing to do. I believe a national strategy, getting all the ministers together and agreeing with mandatory immunizations and a consistent schedule is required unless there are medical or religious contraindications. In conclusion, I have 3 points. First, we have to emphasize and illustrate that vaccines work, and without vaccines, outbreaks occur. And my esteemed colleagues have given many ideas as far as that. Second, I believe a national mandatory vaccination strategy should be in place to protect all children, especially vulnerable children. But I believe it should be framed within the context of social responsibility, that you are your brother's keeper, and you can do something to keep a vulnerable child safe. I believe that most people, if given the opportunity, would do the right thing. Third, as a social responsibility issue. I believe that Inuit babies in Nunavut need a strategy for universal RSV antibody to avoid the astronomical rates of hospital admission, ICU stays, and complications. We all need to strategize to make this happen so that in 20 years from now, the government in power doesn't have to issue another apology to the Inuit for knowing what the right thing to do is, but failing to do it. Thank you.
Thank you, Dr. Banerjee. Thank you so much for sharing your compassion and your experience, and for reminding us of that this is a social responsibility issue. You have a lot of people that agree with you. Last of our panelists, but definitely not the least, is my favorite pseudoscience debunker, Professor Tim Caulfield. If you don't follow Tim on Twitter, you are really missing delightful stuff. So I would highly recommend that you do that. He's a Canada Research Chair in Health Law and Policy, a professor in the Faculty of Law in the School of Public Health, and a research director of the Health Law Institute at the University of Alberta. His interdisciplinary research on topics such as stem cells, genetics, research ethics, public representation of science, and health policy have had him publish over 350 articles. He contributes frequently to the popular press and is the author of 2 national bestsellers, which I've also read and are outstanding: The Cure for Everything, Untangling the Twisted Messages About Health, Fitness, and Happiness, and Is Gwyneth Paltrow Wrong About Everything? Answer is yes. His most recent book is The Vaccination Picture, and he's also the host and co-producer of the award-winning documentary TV show A User's Guide to Cheating Death, which has been shown in over 60 countries and is currently on Netflix.
Well, thank you very much, and it is a real pleasure to be here. Thank you to the senators, and what an amazing panel. And I agree with absolutely everything that has been said. This is a wonderful opportunity. I think that we should view the coverage that vaccines are getting, the attention that vaccines are getting, as an opportunity. And I think it's also an important opportunity to emphasize the impact that misinformation is having, and that's what I really want to talk about. Yes, misinformation is being spread, as you've heard, on social media, on Twitter, on YouTube, and this misinformation is having an impact, and research backs up the fact that it is having an impact. And yes, this misinformation is also creating confirmation bubbles, and it's creating communities where this misinformation is being spread and having and also emphasizing the impact it is having on those communities. What I want to talk about, because some of the other speakers have covered the main points I was going to make, are issues that I think that are worthy of further attention. And the first one Noni touched on, and this is the idea that narratives matter, that narratives have an impact. And research shows us that again and again. In order to emphasize this, I want to draw on what perhaps is one of the most famous moments of anti-vax nonsense, and that is Jenny McCarthy's appearance on Larry King. Have you guys seen this? It's an infuriating moment in pop culture. Here's Jenny McCarthy on Larry King, and she's talking about the myth that autism is caused by vaccines. And she's there telling this story, and she is there with, I believe, 3 experts on vaccines. People who have probably spent their entire lives studying vaccines. They're doctors, they're PhDs. But who do we remember? Jenny McCarthy, right? And it's not just because she's a celebrity, although that's a big part of it. It's because she is a mother telling a story about her child getting autism. And Noni, she talks about it in exactly the way you described, right? It's the causal illusion. She had a vaccine and her child started to display these symptoms. It was sort of a worst case scenario because she builds on the causal illusion, and she has this story that parents can resonate with, which touches on the point that Andre made. Parents want to make the right decision, and she's speaking to parents who are struggling to make that decision. And I think it's a wonderful, although an infuriating example of the power of the story, of the power of the narrative. And we should I'm going to come back to that at the end. The other point I want to emphasize is the broader issue about pseudoscience, and Andre talked about this. I think our society for far too long has tolerated pseudoscience and misinformation. Our own research, for example, has found that there is a significant amount of anti-vax rhetoric on the websites of alternative practitioners. And we've done, as I said, we've done studies on this, in particular in the context of naturopaths. But there is anti-vax rhetoric there, and some of it is explicit. So it's, don't use vaccines, use alternative vaccines like homeopathy. But a lot of it is implicit. It's much harder to point the finger and say this is anti-vax rhetoric, but I believe it is. And this is like the idea that you can boost your immune system naturally, and that, for example, there was a company that was recently selling tissues. I've heard about this, used tissues. So if you have a cold in the audience, you can sell your tissue for $80. And they couldn't keep up with the demand. Now, it's ridiculous on so many levels, right? Scientifically, the idea that people are sending in their used tissues, I can't even picture the mechanisms of the operation. But the thing that worries me is the implicit message is that doing this naturally is better, right? That getting a cold or getting the flu naturally is better. And that is sort of this implicit anti-vax message. And I think that is, very problematic. The other thing that we haven't emphasized, I think, enough is the ideological component of this story. Andre touched on this, Nodi touched on this. There is an individualistic aspect to the belief system around anti-vax, and there's research to back that up. There's evidence that has shown that is the case. In fact, there was a fascinating study that came out not that long ago, I think early 2019, that showed a correlation between the rise in populist beliefs. So what's happening in the United States, what's happening in Poland and Hungary, and the anti-vax movement. Now, that's a correlation, of course, and the relationship is undoubtedly complex, but I still think we need to remember that there is an ideological component to this. So when we're responding to the anti-vax rhetoric, we have to remember that dimension. And I also think the important thing that everyone has touched on is trust, right? Trust is so fundamental to this discussion. Now, I get a lot of hate mail, and I know Andre gets a lot of hate mail. I'm sure you get a lot of hate mail. I'm sure people in this room get a lot of hate mail. And so we actually decided to do a study of my hate mail at the Institute. And so what we did is we looked at over 300 bits of hate mail. And was actually, Andre, in response to a piece I wrote for the Globe and Mail. And we thought this would be an interesting exercise. And what we found is an incredible consistency in the messaging. What almost doesn't matter what the topic is, the message is the same. And the first paragraph is about trust. It's about, I don't trust you, I don't trust the system. And a lot of that is connected to the perception of profit. The idea that the pharmaceutical companies are profiting from vaccines. And there has been empirical evidence, more robust than my hate mail analysis, that shows that this is the case, that often people that distrust the vaccination message believes there's a profit motive behind it. And I think we need to remember that, and when we're messaging about vaccination, tackle that idea and talk about the independent research, the independent messaging, the independent analysis that goes on around vaccination. Now, everyone here has also talked about the impact that this misinformation has, but I also want to emphasize that. There is compelling research that shows, as Andre was talking about, the impact of false balance. There isn't two sides to this story, right? But for too long, it's often portrayed that way. And research shows that portrayal of false balance can impact vaccination intention. So something else that we absolutely need to tackle. And the other interesting thing is research has also shown that these social media platforms, Twitter, Facebook, emphasize that false balance and create a polarized discourse. So again, something else that we need to tackle. There's also fascinating research that shows I call it it's the mere exposure effect. It plays on some of the cognitive biases that Noni was talking about, but including the availability bias. So the mere exposure effect is just being exposed to nonsense. And this is the way that fake news works. This is the way that conspiracy theories work. Just being exposed to this stuff does create a perception of credibility. The more you see something, the more believable it is, the more credible it is. In part that's because you're able to recall it faster. So just being exposed to this nonsense, it matters, and it has an impact. A recent poll from BC, I'm sure a lot of people saw this, found that over 20% of the population believe the big pharma conspiracy theory, the idea that vaccines are being pushed as a mechanism to create profit for the pharmaceutical industry, and that somehow the government is in cahoots with that conspiracy. So, this matters. There was a study that was done here in Ottawa by my colleague Josh Greenberg, where he found that 28% of Canadians, Canadian parents, have some degree of hesitancy tied to the autism myth, right? That is pretty remarkable, right? You think almost a quarter of the population have some degree of hesitation because of a lie, right? So pretty remarkable. But again, it reminds us all that just being exposed to this nonsense, it does matter. So what can we do? What can we do? I just want to go through a few points here. Yes, we need to work with the platforms, Facebook, Twitter, YouTube. We've got to figure out ways that we can battle the misinformation that is flowing on those platforms. But like Andre says, I'm not completely sure how we can do that, at least from a regulatory perspective, from a national policy perspective, but we need to try. I also think we need a more robust regulatory response to the spread of misinformation. So when a regulated health professional is spreading misinformation, I think we need to act faster, and we need to act more robustly. And I believe that regulatory tool exists. That is a lever that we can pull, and we're not doing it enough. I also strongly agree that we need to work with the education community to teach critical thinking. And I totally agree with Noni. Let's start elementary school. Let's reinforce it in junior high. Let's back it up in high school. And recent research shows that you can even start teaching it in university and have an impact. And what's interesting is that studies show this works. If you teach critical thinking skills around things like the causal illusion, people can learn it and people can apply it. There was a fascinating study that was done in Uganda where they taught 11-year-olds critical thinking skills in the context of health. And they were able to learn it and they were able to apply it. So we can teach all Canadians these skills, and it can have an impact. I also think, and this is one of the things I'm passionate about, that we need to use creative communication strategies. We need to talk about these things. We need to use the same tools that celebrity culture is using. We need to use exciting narratives. We need to use interesting visuals. We need to use, I think, even people who have a strong voice in this area in order to get across the science. So I'm not talking about battling an anecdote with an anecdote, but let's use a creative narrative to get across the good science. And I think increasingly public health entities are doing this around the world. I also think we need to do more to fight pseudoscience more broadly. I don't think we can tolerate it any longer. I know that there's this idea about being open-minded and there's different worldviews, and that is important. But when something is clearly misinformation, I think we need to speak up loudly and without hesitation. So let's all get involved. Let's all get involved. Let's be on social media. Let's write those op-eds. There was a great study that was done at Yale that showed that op-eds actually work. I don't know if you saw that, Andre. Your career has not been in vain. They actually can have an impact, and especially if they draw on evidence. So let's all get involved. Let's view this as an opportunity. But I want to end with what is the last word in our book, The Vaccination Picture. And this builds on what you were talking about, Noni. Most people who don't get vaccinated, they do it for complicated reasons. There aren't individuals, these hardcore anti-vaxxers, as we've heard over and over again, are a relatively small community, right? So what we need to do is we need to appreciate that there are diverse reasons why people aren't getting vaccinated. There are diverse reasons why people have concerns. So the last word in that book is listen. And I think that that is incredibly important. So thank you again for this opportunity. And I am going to end with my two favorite words, go science. Thank you very much.
Merci beaucoup, Professeur.
Thank you very much, Professor Caulfield.
This morning, I think it was very stimulating. J'aimerais remercier.
I would like to thank our presenters, and now we're going to begin the question and answer round. So please indicate to Sarah if you have a question. As Sarah will indicate interest.
Yes. It's okay. My glasses.
Thank you very much. First of all, may I express my thanks to the panel, to my colleagues, the senators, for organizing this panel. Very informative, and I truly appreciate all the information that's been presented. I would just like to address a couple of points. There was a very powerful message. I'm a senator from the Yukon, the North. We don't have an Inuit population in the Yukon per se. We are Northerners, however, and I found your message particularly powerful regarding the vaccination of Inuit children. There's a couple of points that I didn't hear, or one point in particular that I didn't hear this morning, and that was mention of the role of the community health nurse. Quite often in northern communities, there won't be the access to a physician per se, but there is a very powerful individual in the community health nurse. And I would like to suggest that our approach, and I do hear the call to action very clearly, I'd like to suggest that we need to call upon the health ministers and the education ministers, as Mr. Caulfield has suggested, regarding the regulatory. And we also need to call upon the healthcare practitioners and include the community health nurses in that picture, as not to the exclusion of doctors, of course, but to include the community health nurse. And ultimately, to call upon the finance ministers to fund the healthcare requirements, the vaccinations, the common vaccination program. So I'd like to just make that observation and thank again the panel and my colleagues for organizing this presentation this morning. Thank you.
Would any of the panelists want to respond?
Thank you very much. Your point about community health nurses, I hope we didn't come across that the only people that immunize in Canada are physicians, because in many provinces it's done by public health. It's all public health nurses. It's not physicians. Depends where you live. And I want to say that some of the most creative programs that have been evaluated in Canada for delivery related to the convenience issue are seen in the North. So in many of the small communities in the North, the public health nurse actually goes to the home to deliver immunization. If you've got 3 kids under 5 and it's minus 40 out, you are not going to bundle them all up and go. Somebody needs to come to you. So I think we can learn from some of those best practices in the North, and we need to do them in the South.
Yes, thank you. That's what I was trying to say.
Senator Moodie.
My question to the panelists is a little bit of a compilation of all the issues that I'm aware of. And I see one common thread here. How can we get beyond the jurisdictional challenges that we face as a country when we consider our failure to establish a national vaccine schedule, the regulatory challenges that we all acknowledge would be stand in our way if we wanted to look at a mandatory immunization program, even something as what sounds like it should be simple, a national immunization record-keeping system. All of these things are big challenges to us because of our structure, our political structure. Where are the solutions?
Who wants to start?
we're not the only country where health is a provincial or state, among the OECD countries, state responsibility. And what Australia did is federally they put money on the table, basically. And that's why they have one schedule in all but one of their states. And they brought them together and said, here's what we're offering and here's what we want. And it has made a big difference for them. I want to back off mandatory a bit. It is way more complicated than has been put on the table. And that would require a lot of conversation before we need to go down that path. It's really complex. And as Andre pointed out, in some of the places where they have put mandatory in, for example, no pay, no jab, in Australia, the people that have been hurt the most are actually the most vulnerable populations, the ones who are the by-the-hour wage earners who couldn't get it, and now they've lost $15,000 because their kids are not immunized on time. So I think you have to be very careful when we throw those words around. It's a very, very complex area. Your other piece for the regulatory changes, again, and I'm flipping to Australia, and maybe Tim can give some other ones. The Fair Trades Tribunal in Australia took on one of the anti-vaccine websites and took them to court for false advertising, and they won. All right? And the site no longer gets charitable status. And guess what? When it wasn't getting money, it shut down. Because it was all about the money, folks. Money is behind a lot of this. It's not as simple as what people think, that it's in their hearts to change the world. For many of these sites, they're making money off of these sites. Okay? And that's... So I think we do have, and Tim, you might want to pick up on that. I think we do have some regulations that we could use.
Yeah, and so many of them are complaint-driven. So this is one way that the public can get involved, and organizations can get involved, and NGOs can get involved by issuing a complaint. And the other really important point that Noni makes is often there is a product that is being sold, right? It's a supplement, it's an alternative natural approach to vaccination, or even it's a service that they're providing. And so therefore, that offers the opportunity for other regulatory tools like truth in advertising that can come in, which is a federal approach, by the way. It's a federal tool that can come in and yes, it's only one. It's probably only one provider that you're actually making a statement against. But then you have a precedent that you can point to, and we've seen that happen in other jurisdictions. And I think it's a very useful tool.
Any other comments on that, Mr. Picard?
I'd just say very briefly, there's no constitutional impediment to cooperation and to common sense. So let's stop hiding behind that excuse. And look, for example, so the Canadian Blood Agency is a striking example of all provinces agreeing to common rules and distribution rules for a drug. There's no reason it can't be done for vaccination or anything else.
Senatress Deacon.
Good morning, and thank you all for being here. Really, really compelling and a great combination of experience and places that you come from. I'm a senator here, and I've come from the Western Ontario area. And my job, and it was a privilege, but it was challenging, was that person who, before I came to Senate, was a superintendent of schools. And come March and come May, my work was dealing with public health for those families that I would say were the most vulnerable, that were moving from place to place. And if you know it, it's a very difficult time when you get from 60,000 students to probably 600 families. That final push, lots of effort to communicate, lots of effort to get the vaccinations done. But come the day, come the sort of the come the day when the Suspensions to Pupils Act was put into place, families dropped their children off in my arms, literally, and saying, I have to go to work. I didn't get a letter. I don't know what you're talking about, or I don't believe in vaccine. Variety, every possible. And it was a very, very difficult time. And my job was to kind of mitigate with the medical officer of health and the communication and a really crazy 72 hours, frankly, twice a year, really, and be able to also support our families. And I bring that up because it still does exist, and it's still a huge challenge. And we learned that we weren't working well with public health. We weren't providing. There were a number of pieces that we continue to try to improve upon and make better and better. But the reminder today is this is a million little pieces. This is a multi-prong. This is trying to get so many things, in some cases, fine-tuned, not significant changes. But my piece and my place where I still continue to look for support has come out already this morning, and that is how we ensure that we are trying to get the accurate information, reduce levels of it's a bus ride, it's a parking fee, it's a doctor who's away, it's my form was lost, it's a fax machine not working. They're all every possible reason, and how we bite those off to make this a seamless national effort. Nobody wants to be where we are in many of these cases. And it's very interesting watching New Canadians. And we talked about the lineup I think you referred to. There, once you have that front end communication of quality, of good communication, I think they're a really good example. Frankly, they're a very good example of education. This is it. There are no two sides. We're lining up. And somewhere between that and the rest of our population, massive challenges that we really, have to work on together. And some of my colleagues have responded to, particularly Senator Moodie, what are these national pieces we can put together that helps those nuts and bolts that I'm talking about that are happening at the community level. So I do applaud, but I also recognize it is complex in some ways, and frankly, simple in others. It's getting it done. And I'm not sure if any of you want to comment to that piece, but I feel it, and I have great compassion for all angles of this challenge and the hopes that we can get it better.
Thank you, Senator. Anyone would you like to comment? Oui, absolutely.
Sure. Can I do one piece building on that? One of the things that I think is deeply disturbing to many of us, and Anna announced part of it, but if you look at our cervical cancer rates in Canada, Nunavut has, in some of the villages, the highest rates, tenfold higher than you'll have in other ones. What territory/province was the last to roll out an HPV vaccine program? Nunavut. Not because they didn't want to, but because they didn't have the territory resources to get it developed and rolled out. If we had national programs, they wouldn't have been 2 years later at the table. And so it's not just the money, it's about how it's organized, which is, I think, what you're talking about. Some of this needs to be done right at the front door of the local people, and some of it needs to be national, and we need to figure out how to make that work better.
Thank you, Senator Pate.
Thank you very much, and thank you to all of you. And as you were talking, one of the things that I thought of was how the campaigns that have been so effective around physical activity, wearing helmets for bikes, eating properly, and not smoking, all of those have started really with kids being educated early on. Are there many education programs happening in the schools around these sorts of issues?
Okay. Sorry, I'm going to give a global perspective on that because of the stuff I do with the World Health Organization. It's now increasingly being recognized that this has to be done in schools. I'm not sort of babbling on this. We have in Canada, we've had a resource in place for now, I think somewhere around 18 to 20 years, for the national poster contest that comes with the annual, the Canadian Immunization Conference, where grade 6 teachers have access to materials to teach. But other than that, we did not have formal curriculum. Ontario is, I'm supposed to be rolling out for 2020, meeting what their Chief Medical Officer of Health's report was in 2014, a curriculum to go in schools. In Nova Scotia, where I live, actually, I met with several people, curriculum development people in education, and we're hoping to roll out science literacy and the rest, using vaccine as the example, in 2020. But it needs to get done in a really concerted way. And we will be here for another generation talking about this if we don't get started. So we need to get going. Enough is enough.
Sorry, you may have added to, but I remember being a kid and just we'd all stand up and line up to be jabbed. And,
Okay, so we've just finished a study on that, at trying to make the school immunization program more a more positive experience. It just got published in Pediatrics and Child Health on the beginning of April, and it was done in the Niagara region, schools with and without the intervention. It's called CARD, which is Comfort, Ask, Relax, and Distract. And the CARD schools, after it was put in place, for the kids, it was way more positive. They were much less afraid. They much more valued what was happening. The teachers said, the nurses said, public health nurses giving the immunizations, we can't go back. We have to keep doing this. And the teacher said, the strategies you've taught these kids, we want to use them in other stressful situations. It's going to be piloted again in Alberta with much larger populations, because that was, I want to call the schools kind of southwestern Ontario, urban-y, suburban-y, as opposed to Alberta, where we're going to be doing the whole range of things. And that data, I hope, will be in within a year. So we know how to make it better and much more positive for kids to get immunized. But now we need everybody moving out to do these kinds of things. When this was presented at WHO last week, people were all over us for this information, because this needs to be done globally. Because when school kids aren't so scared, they're not going to grow up to be scared parents either. You know.
So Professor Caulfield, and then we'll go to the next question.
I wanted to use this opportunity to talk again about the multi-prong approach with respect to the messaging. And so this is more on with respect to patients, but I still think it's highly relevant. And because you heard multi-prong, I think we all said it. And that's what works. So there's a fascinating study from 2015 in the United States where they found that the most effective strategy is to, yes, talk about what the consensus is. So here's what the scientific consensus is. So you still need to go with the facts. But in addition to that, use a story from the perspective of a parent and use pictures, right? So if you use that, so pictures of what the disease looks like, what could happen if you don't get vaccinate your kids, that multi-prong approach had the biggest impact on the vaccination hesitant. So these are people who are hesitant, not necessarily hardcore anti-vaxxers. So I think that is, whether you're talking about teaching kids in schools or whether you're talking about addressing hesitant parents, multi-prong is the way to go.
Thank you so much. I just wanted to mention that we have 30 minutes left. So, and I have quite a few participants that want to ask questions. Just to give you an idea so you can get ready, I have Dr. Tanya Starhart, Tara Hills, Dr. Davila, and Dr. Sue Bennett in that order. So Dr. Tanya Starhart, who is an emergency physician at Queensway Carleton Hospital.
Good morning, everyone, and thank you so much for the opportunity to speak and to witness this conversation. I will say I'll have my own story. I am a mom of 2 vaccinated children, school children, the daughter of a parent who is immunocompromised due to cancer therapy, and a colleague of a healthcare worker who is also immunocompromised and is currently not working because there was a measles case in our emergency room, which is a huge financial burden for that individual. So I work in a community emergency room. We see about 75,000 visits per year, and 30% of which are kids. And I guess my comment and question is multifaceted. I feel a bit powerless as a healthcare professional at times due to the social media tsunami of misinformation. And I usually don't have an extended period of time to interact with the patients that I see, but I would like to make an impact when I do that. And as a frontline healthcare professional, I feel like I need further training and better education how to reach these people. And I also feel like there's a lack of education and information on how to influence people to focus on positive ways to convince parents that this is the right thing to do. And I appreciate all of the panelists' comments about education and training. I would like more information, and I would like there to be a national strategy, not just educating the public, but educating healthcare practitioners, everyone across the board. So, of course, medical school, nursing school, allied healthcare practitioners, and the like. And I want to learn some strategies to build trust and to influence vaccination rates positively. And I think we have a team assembled. You know, it's just there needs to be better access. And I truly would like to learn some strategies. And if anyone has any suggestions, I think that'd be great. But I would recommend a very national strategy.
Any comments, Dr. Tam?
That's a very important point. And so I've, as the Chief Public Health Officer, I convene a health professionals table where 18 national health professional organizations are there, and I have approached them to how do we better support and they are nurses, Indigenous physicians, many different pharmacists, because they're all at the front lines of answering parents' questions. So I think we're looking at, well, what's the most, I think, efficient but also effective ways. I did mention CanVax. CanVax is an online database of curated evidence-based researchers focused on supporting the health professionals. So there'll be some tools there. And I do think that there are tools. We just need to sort of pull them together in a much more visible way, so that if you're in an emergency room, you're not sort of going around trying to search for these things. So I think definitely that kind of repository, if you like, is being pulled together.
Any other comments? Dr. McDonald.
If you go on CanVax, there's mini motivational interviewing, 5 minutes with your patient. That's it, okay? And there's a tool there for learning how to do that. The Canadian Pediatric Society also has a workshop that will be again in the fall. I can't remember the exact time. That'll be with the College of Family Physicians, again, teaching mini motivational interviewing, because many physicians and nurses and pharmacists, you only have 5 minutes to do this because you can't take 2 hours, okay? And this is why it's been structured this way, and it's actually evidence-based. This works.
And building on that, there is a study that came out relatively recently. Now, this is in the context of HPV, that shows that using the tools that I described, and I'm sure they're very similar to what you're describing, can have an impact on uptake. And what I'll do, I'll tweet that story out right after this event.
Thank you. Tara Hills? She'll come back. Yes, that's okay. Yeah. Yes, I will listen to her. I will ask her. I'm just going to see if she's ready to ask the question. Great. Thank you. Hi, Tara. Would you like to? Yeah. Thank you, Sarah.
Hi, everyone. Thanks for inviting me. Thank you, Senator Moodie, for inviting me. It's really great to be here. For some of you who maybe don't know, got a little bit of unwanted fame a couple years ago when I was vaccine hesitant and I had changed my mind. There was a whole story. You can Google it. And all 7 of my children got whooping cough just a week before we were set to start catching everybody up to date. So that's what brings me here today. I have a vested interest in this and have had a lot of opportunity to speak in the media, and it's a lot of pressure because I don't want to screw up the opportunity and, you know, do more harm than good. So thank you for having me here today. This is very educational and edifying and encouraging. Something I have not talked about publicly, so I'm a little shy to talk about it today, but I'm just going to go for it, is that part of my hesitancy wasn't just some of the things that were brought up today, some of the myths and the misinformation just brought me to a point of hesitancy coupled with not even seeing a threat. So I understood how it happened and how it happens to others still. So it's not always a one-size-fits-all scenario that leads to vaccine hesitancy. But one thing that I don't often hear talked about in the public, and perhaps because it's not statistically a big deal, but it's a big deal to those to whom it's a big deal. One of them is the use of fetal aborted tissue cells in the development of certain Canadian vaccines. And I'm not a doctor, I'm not going to get into it. Some things I've heard and it's on record, like rubella and how that was developed. Others, I'm not sure if it's just rumor and hearsay and people getting all worked up within some of my personal communities. But knowing how important peers and community are in those decisions, I don't want to downplay it because there's another hot topic, like abortion. But I feel a conviction to talk about it in this hopefully very welcoming, safe place where I can say, this for some of my friends, and still for me, is a serious barrier. And I'm not sure if that's being addressed in any way. If it's very quickly dismissed every time I've sort of heard people talk about it. Oh, nobody cares about that. Oh, we don't talk about that. That's not a big enough deal to enough people. And it's kind of just shoved under the carpet. Now leaves a bad taste in people's mouths. People that I personally know who are not anti-vax per se, but choose not to avail themselves of the MMR triple vaccine because rubella is bundled in a triple. So I know people who right now are struggling between a rock and a hard place, and I'm one of them. I chose to vaccinate my kids, but I had to go against my integrity to do it. That's hard. It's a hard thing to ask anybody to do, to choose between their children and their core values as a person. That's tough. And though we may not share that value here as individuals, I'm sure you all can respect if that's profoundly important to someone. It shouldn't just be dismissed. So I want to comment on that, share that. I also want to ask if anybody feels like they could speak to that, how I could direct some of my friends who have made a different choice than me. I'm treated as a sellout to some of my friends because I'm not making a stand for the use of fetal aborted tissue cells and diploid strains, the development of rubella, and etc. It's so hard. So I wanted to ask how I could speak to them, how I could direct them to encourage them, not to trash the friendship, and to say, here's what you could do beyond talk to your MP. I just wanted to ask if there's any possibility that the triple vaccine could be released, because these friends, some of them have gone to the States because they couldn't get a doctor in Canada to give them their own monkey strain of rubella, the previous one before the one developed in the 70s. That's a tough issue for some people. And for them, it's the only issue. They have no other objections. They're totally on board with the efficacy and the need for vaccines. But that one is their final stumbling block, and there they stand, stuck. And I really hear them. And I'm in this unique, weird, totally unwanted position to speak in these weird forums. They're weird to me. But I don't want to miss the opportunity. So thank you for letting me share something that's very difficult, very vulnerable for me to share, but I also feel a weight of responsibility that I need to use my opportunity to speak on behalf of some people who feel like they only have Facebook to rant on.
Thank you so much, Tara, for telling your story. It's quite important that we listen and we're hearing you. So Dr. McDonald, would you like to comment?
First of all, it takes a strong soul to speak out in this kind of a forum about something like this. Secondly, I think this is the piece where words matter, all right? And you've raised an issue that I've heard from other parents. But often when I've sat down and talked to those parents, what is not clear to them, those were never aborted fetuses. Those were spontaneous miscarriages where those fetal cells came from. They were, but because, I'm using this term in medically, because we talk about spontaneous abortion, it got moved to abortion.
Is that right?
Yeah, and it was actually miscarriages. Wow. These were miscarried fetuses that the cells came from. This was not a baby that was aborted. Okay. And that's where those cell strains came from. But that's a complex little scientific piece of technical information that's not easy to get across.
No, I haven't really seen it.
And the misinformation, because the word is there and it's a technical word, spontaneous abortion, it sounds like it's an abortion, okay? Right. Where if they had said these were miscarried fetuses. That
autopsies.
Yeah, exactly. Right. And that's where those cell lines came from. I think it would have changed everything. There is that information on a number of websites, but again, I don't actually think, coming back to what Tim said, I don't think it's been said in a listener language viewpoint. So people went into all these technical things about how the cell lines came into being without missing that the problem was the word. Okay? And words matter. So please, spontaneous miscarriage. That's where those cells came from.
So, Noni, where would I go to find that so I can share that with my friends and say, hey,
I think, and maybe you can help me, Elizabeth, is that in Your Best Shot? I think it is. The CPS book, The Best Shot. I know there's lots of places, but I want you an easy place where you can find
Yes.
it. And I think it might even be on Caring for Kids' website in the immunization piece there.
That would be really helpful.
Okay.
Yeah.
But again, I don't want them to get technical because that's where people get lost. You don't care how the cell line was terminated and blah, blah, blah,
No,
blah,
I
blah,
don't.
blah. You care about that word at the beginning.
Yeah.
Okay. And we need to get that word changed.
That would be huge. Another quick comment, talking about the money piece, the game changer for me when I finally got to a point of talking to somebody who treated me with respect and dignity and didn't immediately bite my head off for not vaccinating my kids, which was Leslie Waghorn, bless her heart. The big component for me, and I just don't know why this isn't on the front page of every newspaper, is that, to my understanding, the Canadian childhood routine vaccines, there's no money left in them anymore because the, give me the word, what's the word again? The patents ran out.
Yeah.
And as soon as she told it to me, I was like, are you kidding me? She's like, yeah, here's public information. Click, link. We were talking through Facebook. And she's like, yeah, you can check it out yourself. There's no money left in Canadian childhood vaccines. I was like, well, you just blew my biggest argument out of the water. Thank you very much. And then I was able to move on. A week later, my kids were scheduled. That's all it took. Couple of minutes. She identified my questions. It was brilliant. It was beautiful. And it changed, well, now 9 people's lives.
Thank you so much.
So just to encourage you that that's a really key component right there. Last thing I want to say while I have the mic is I think it's brilliant to focus on prenatal care as a great catchment opportunity because I have a series of meetings and conversations in a very low pressure. I'm nesting, I'm getting happy to have baby, thinking of new moms. They're excited, they're very open to information, and that's a repeat contact. 2 months out, when they take their first scheduled childhood vaccine, they're in the worst possible place to make an on-the-spot decision. When they're tired, they're still recovering from birth, they're dealing with all of the emotional and physical stressors of being a new parent. That might not be good planning. So I wanted to suggest to and encourage any focus. I don't know, I'm not talking regulatory, I don't know how it all works. But that relationship between me and my OBGYN or my midwives is a brilliant place to focus on this multi-pronged approach to encourage that.
Thank you so much. I have Dr. Davila. Dr. Davila.
Yes.
Thank you.
Well, goodness gracious, it's hard to follow after Ms. Hills, and I'm thinking, first of all, I will thank the organizers here today for allowing me to be here, to the panelists for their excellent remarks, to Ms. Hills, who, if you ever want to come and work for public health, we'd be very pleased to have you, because I think you bring a very much a sense of realism, a sense of practicality, and a wonderful openness to your comments. So thank you so much for sharing your comments and your thoughts with us. I think that's very important for those of us here who are in a position to do something in the public health realm. I will be following up with you afterwards. And so anyway, I'm the medical officer of health for the city of Toronto, and am interested in hearing the thoughts of the panelists on the issue of advertising. We've had interesting advertising campaigns in our city, not tied to particular products, so a little more challenging to go at through existing regulations on false advertising with respect to products, but certainly the kind of advertising that sows seeds of doubt, not specifics, not specifically attacking particular science, just creating a general sense of distrust. And I'm interested in hearing the panelists' thoughts on, what venues, from a legal perspective, from a legislation perspective, what opportunities might there be to actually addressing this issue, knowing that we have mere exposure effect, right? And allowing those things to perpetuate creates problems. But we also have to think about, not furthering, the anti-vax movement or bolstering, the sense that you see there it is again being squashed, it's the money issue, all those sorts of things. So just interested in hearing the panelists' thoughts on how we might actually approach those issues.
Merci. On commence avec Professeur Caulfield.
Thank you, Professor Caulfield.
Of course, you're talking about the billboard campaign that occurred in Toronto. That was fascinating because there was a robust response to that when it came out, and I was involved, as you probably know, I was involved in that response. It was covered in the media, it was covered on social media, and and as a result of that, the billboards were taken down. Now, here, a very interesting thing happened. So I got an email from the individual that put up the posters saying, "Thank you, Professor Caulfield, for bringing more attention to my posters." And of course, it touches on, I think, exactly what you reflect. Now, my response is, I get, it is a problem because I'm just enhancing the mere exposure effect by just ranting about it, right? But I think long term, that's still the right approach, because I think you set the record straight, and it may create a blip. Now, I think it's still important to move forward. In addition to that, you often hear the freedom of expression complaint. These are private actors. Part of freedom of expression is the marketplace of ideas, and what you want to do is win the marketplace of ideas with good ideas. This is not repressing someone's freedom of expression. It's using the marketplace of ideas in order to get the right message across. So I'm absolutely fine with how that played out in that context. If they're selling a product, or if they have misinformation that it goes against a professional obligation, I do think there are regulatory tools that need to be used, and to be used quickly.
Thank you. Any other comments, Senator?
Just being promoted. Yeah, I think I would agree with Tim. I think we've heard, what else can we do? So I think more analysis is required on that front. But if it is a commercial product and it's under the Food and Drugs Act, you've seen NOZOs. Health Canada comes out and go, NOZOs are not vaccines. They never have been. There's no substitute for vaccines. Put a massive piece of communication on that. That's within current legislation. You are much more in very difficult domain when you're talking about what Tim was just saying, that they are private actors. They're not necessarily selling a particular product, and you're into charter territory and freedom of speech. But as many people point out, there are ways to counter that with better ideas and better ways of quote unquote marketing. So I think you need to look at this issue from different fronts, because one domain may take you many years of trying to tackle some of these freedom of speech considerations, whereas some of the other strategies you can perhaps put into place very quickly. In terms of professional groups that are regulated, many are self-regulated, of course, and whether they are chiropractors and others. In chiropractic practice, vaccination is beyond the scope of work. And the colleges actually do say that, although whether they practice that or not is a question. So I wrote to the college and make sure that they read my statement and say, here are the credible sources, because it's beyond your scope of work. Direct your clients or the Canadian that you're speaking to the actual credible sources. So, and I do hope that with engaging the national health professional organizations, they will come on board and make sure that these kind of malpractice, if you like, doesn't continue.
Thank you. Okay, so Dr. Sue Bennett from the University of Ottawa. Dr. Bennett.
Thank you, and merci to all the speakers and to the Independent Senators Group for organizing this Open Caucus. It's been extremely enlightening. Mine is a brief comment. Canada is presently undergoing its 6th review of the implementation of the UN Convention on the Rights of the Child, which is one of 9 global human rights treaties. Canada ratified the convention in 1991, and we are celebrating the 30th anniversary this year. As a country, we've made a promise to children in Canada, and we have an accountability to the highest levels of health for our children within a global human rights legal framework. So I would like to see the discussion to include the human rights perspectives along with the public health and economic perspectives, and recognize Canada's obligations under the convention. I'd just like to quote Article 24, the first part. State parties recognize the right of the child to the enjoyment of the highest attainable standard of health and to facilities for the treatment of illness and rehabilitation of health. State parties shall strive to ensure that no child is deprived of his or her right of access to such healthcare services, and it goes on.
But I have to say, if we had a federal commissioner for children and youth, this would be a much easier discussion today for discussion and action and remedy. Thank you.
Thank you. Any comments? Dr. McDonald.
I had the pleasure, must be 2.5 weeks ago, hearing Kate Gilmore, who is the UN Deputy General for Human Rights, speak in Geneva. And she is a powerful speaker, an amazing woman. And basically the thesis she was putting forward was, it is the right of every child in every country to be immunized, and we need to do it, basically. A very powerful speaker. And she sees it right under this convention, and we are failing.
Any other comments? Any other response? Okay, merci. Kim Perrault.
Thank you very much for the opportunity to speak to everyone. It's been a wonderful morning. And to the senators who are also here, you have heard from some of the best individuals that we have in Canada on this topic. I want to first speak to Professor Caulfield, and the new attack that we are seeing is unprecedented. And I think the personal nature that this is taking is truly unbelievable. It's something we have not seen in the past. I've been speaking most recently to a parent who's had that same kind of attack, meant to silence you and her. Essentially, I think it was covered on CNN. Perhaps some of you saw it last week, where on Facebook, she was told by individuals of the anti-vaccination movement that her child may not have ever existed, or that she killed her child by vaccinating him. And this is the kind of activities that, rocks all of us to the core. You've just not seen this kind of activity in the past. And for those of us involved in vaccination, we really need to think hard about how it is that we are approaching these individuals. And for me, I've been involved in vaccination for my entire career. And one of the things that I find frustrating and that comes up repeatedly is the support that's given to healthcare providers. And I think this was addressed as far as what do we know, how do we learn it, and how are we consistently supported throughout our careers to be able to deal with these types of issues. And perhaps I'll speak directly to Dr. McDonald, being, of significance with regards to curriculum. For healthcare providers, I think this is a big concern. And I have seen repeated research that's been done amongst parents, and they say that their number one resource as far as making a decision for whether their child is immunized or not is their healthcare provider. Yes, parents do have an influence on Facebook and others involved, but a solid, convincing message from their healthcare provider is the number one resource and the way that they make their decision. And yet, if you go to many of the healthcare providers and ask them what kind of education they received, they will tell you very, very little. In fact, I know from my own personal experience, most physicians will tell you that they learned about vaccination from the nurse in their clinic. She taught them about immunization and how to interact with parents. Now, that may be a historical approach, but that's very sad. And when it comes to how we are addressing this, one of the things that's come to my mind as being a very big concern is that there's a lack of consistency among all of the schools of education, be it pharmacists, be it nurses, be it doctors across this country, in what is in the actual curriculum that's being taught. And this is at the core of where we need to start. And if there's a regulation that needs to be addressed, I think it's that one. Thank you.
Thank you. Any response?
First of all, absolutely. The number one study after study after study after study has shown that what the healthcare provider says to the parent or to the patient totally influences their decision making. The second piece of that is how well immunized the healthcare provider is themselves influences what they say. So the third piece there is curriculum. You're right. And studies across Canada have shown that the range of hours on immunization in curriculums in nursing schools and medical schools ranges from 1 hour to maybe, if you're lucky, 2 or 3, which is not enough. The best way I know to influence curriculum of professional schools, bar none, you put it on the licensing exams. All right? And if it's on the licensing exams, let me tell you, as a former dean of medicine, it will be in the curriculum. Okay? But the other piece that you mentioned, and I think I want to pull out on that, is safety. And there is a lot of issues for healthcare professionals now and for parents because they are receiving nasty hate mail. When we developed with WHO Euro how to address vocal vaccine deniers in public, and I was part of the group that did that, there's a whole chapter on how to keep yourself safe because the trolls come out. There is no doubt about it. And sometimes the trolls come out in public. And you need to be able to work that through. And we've not taught how to do that either. And I know that scares people off to even want to speak in public. And we need to make it unacceptable that people are being ambushed for telling truth and showing what the science is. That just should not be. It's like hate. And there are many other hate areas that we don't allow that to be done with. I don't see why a healthcare provider should be vilified because they're speaking evidence.
Thank you for that. Our time, unfortunately, has run over. I think that all of us could continue in this discussion for many more hours. I want to thank our panelists very much, and all the people in the audience, those of you who raised questions and those of you who wanted to but didn't have time, that you've made it very clear that for us to support, enhance, and improve public health, we need a multi-pronged approach that involves all of us, those in this room, but most importantly, those that are not in this room. You've stressed the importance of science, social justice, human rights, effective communication, education, and the policy, legislative, and regulatory frameworks. I want to thank the Open Caucus for allowing us this opportunity to raise this essential and very important issue. You all have given us, who are senators, a challenge. And you have suggested and shone a light on some of the ways forward. I want to let you know that we have heard you. We are not afraid to go forward. Thank you very much.
Merci. Bonne fin de journée à tous et à toutes.
Thank you and have a good day, everyone.